So I'm going to show you joint play of the elbow joint. And the elbow joint, when we talk about it, we actually speak about three different joints. We have the Humeroulnar joint, so where the humerus comes down and joins up with the ulna on the medial side of the forearm. And we've got the Humeroradial joint, so on the lateral side of the arm, humerus meets radius. And then we also have the Proximal Radioulnar joint. Okay, so there's three different joints in here. Okay, normally when we talk about the elbow joint, we usually are speaking of the Humeroulnar joint. So I'm going to start with that. So the first thing I'm going to show you is a traction of the Humeroulnar joint. So what I'm going to do here is I'm going to have my client with her arm in slight flexion, because full extension supination is closed pack position. So we have slight bend in the elbow here, and we can do this in a supine position or seated. Right now we're doing it in seated. So you're going to take your arm or your hand and place it on your client's humerus. Gently but firmly, you're going to grip it. We don't want to be squeezing the arm, so just depending on how big your hands are, just be careful here. I like to use sort of the webbing of my thumb and forefinger to sort of press in a posterior fashion as stabilization. Then I'm going to take my medial hand here and I'm going to scoop underneath, bringing my thumb as close as I can to the joint line of the Humeroradial joint. Now, what I'm intending to do here is I'm intending to stabilize up here on the humerus, and I'm going to gently pull away from the elbow joint. So I'm just creating some space. And this is a grade 2 or joint play movement. So we're just taking up the slack. We're not going into any stretching. We're just stopping when it naturally stops. Okay? And I do use this hand to push posteriorly slightly. So it's a bit more than just a stabilization. And then this, I'm not pinching the client. I'm gripping firmly on the top and the bottom, intending to traction the ulna away. Now I'm going to do a distraction of the Humeroradial joint. So we're going to go a little bit more into elbow flexion here. And I'm going to place, I'm really just taking the trochlear notch and scooping it away from the trochlea of the humerus. Okay, so to do that, I'm actually going to grip both the ulnar side of the forearm and the radial side. So I'm keeping my client in supination. And with the thumbs, I'm actually pushing against the back of the forearm, posterior side. So I'm scooping in a motion like this. So just relax your arm there. Perfect. So I'm going to pull and scoop. Just stay sitting back there. Don't let me pull you away. There we go. Good. So the pressure is on these fingers down here, close to the joint line, and I'm intending to sort of just pull and distract the trochlear notch away from the trochlea. Now I'm going to show you the humeroradial mobs, starting with the traction of the humeroradial joint. So just like the humeroradial traction, I'm going to be using one hand to stabilize at the humerus above the joint line, and I'm going to be gripping the radius with the other hand. So this time I'm going to use my medial hand to push against the humerus, just because the radius is on the lateral side of the forearm, and it's easier for me as the practitioner to hold on to it. So again, I use sort of the webbing of my thumb and forefinger to just press and gently grip to stabilize that humerus. And then I'm intending to grab up here the head of the radius, which is slimmer than the proximal part of the ulna, so it's a little bit different. And so with that firm but gentle grip, I'm going to traction, pulling away from the joint line. Okay, and I'm just pulling until a natural stopping occurs. So I'm not going into stretching. I'm using this upper hand here to push a little bit posteriorly, just to help me with this push-pull motion. And the intention is on that radius there. I'm going to show you an anterior and a posterior glide of the Humeroradial joint. And I do both at the same time because it's essentially the exact same movement. And we're landmarking in the exact same way. So I have my client in supine position here. and her forearm is supinated. Now you can put a small towel or bolster underneath the wrist here to keep the elbow in just slight flexion. So what we're going to do with our medial hand, our inside hand, we're going to come and we're going to stabilize just at the joint line. Again, I like to use the webbing of my thumb and forefinger here so I can get quite distal. And then I'm really stabilizing at the humerus. We're obviously going to get movement here between the radius and the ulna, but my intention is to move the radial head as it pertains to the humerus. So I really want to get that humerus stabilized. So with my outside hand, I'm going to come here and I'm going to, again, gently and firmly grip the head of the radius right here. And for my anterior glide, I'm simply going to move the radial head in an anterior fashion here. Like with all of these joint mobs that I'm showing you, this is just a grade 2, so we're just naturally pulling that radius anteriorly until it starts to slow down and stop on its own. So we're taking up the slack of the joint but not moving into a stretch. And then our posterior glide is basically the same thing. We're just pushing posteriorly. And the table generally stabilizes here. I'm going to keep my hand in the same position. So we're going to push posteriorly with the head of the radius. And there's anterior, posterior. I will often combine these because we're aiming to get more movement in the joint. I'm going to show you a proximal radioulnar joint anterior posterior glide. So again, I do these at the same time. This is very similar to the anterior posterior glide of the humeroradial joint. However, the intention here is to move the joint that lies between the radius and the ulna, not the joint that lies between the radius and the humerus. So we are going to put our hands down here. One of them is on the radius and the radial head in particular, and the other will be on the ulna. Now we're going to stabilize the ulna because the radius is much more readily movable here, so it's the thing we're going to try and move. So we grip nicely, not too pinchy, not too hard. Okay, the client is again in supine with her arms supinated, and my bottom fingers here are actually just tucking under enough that we're getting a little bit of lift off of the table. You can put a bolster or a towel underneath the wrist if you like for comfort. I'm going to grip the ulna with my inside hand. Outside hand has the radial head, and I'm going to pull anteriorly on the radial head as it pertains to the ulna, okay? Taking up that slack. There's not as much movement here as there is with the humeroradial joint or the radiohumeral joint. Now I'm going to push posteriorly, get a posterior glide. And when I do that, my fingers on the back here are pushing up a little bit, so it's just stabilizing more from that side. But my hands are essentially in the same position for the anterior glide and the posterior. So again, stabilize the ulna, grip the head of the radius, posterior, anterior. And you can go back and forth like that to get a good sense of the joint play.